Afternoon, early prevention and treatment is saving lives. A new study shows men with prostate cancer are living longer. CBS 47 health expert Dr. Dave here now talking about prostate cancer. This new study, Dr. Dave, what does it show?
Good afternoon, Joey. This is a study from the National Cancer Institute on men with metastatic prostate cancer, disease that spread outside of the gland, who were treated with early chemotherapy at the start of hormonal therapy, the drugs that block testosterone, which feeds prostate cancer cells, or hormonal therapy alone. And the men who received early chemotherapy lived over a year longer compared to the men who received hormonal therapy alone.
Okay, so this is pretty big. It sounds like it's impressive. Why is that?
This over 1 year improvement in survival for prostate cancer is much longer than other several month improvements in survival in other studies on metastatic cancer.
Yeah, it sounds like a pretty big deal. So, new chemotherapy drug, is that why this is going on?
This is a drug called Taxotere that's been around for decades, and it's been used over the past 10 years in certain men with prostate cancer whose disease is resistant to hormonal therapy. And this study proves that early chemotherapy can help these men live longer, and it may be because it delays the resistance to the drug that blocks testosterone.
Are there certain patients who it's recommended for?
It could be beneficial in men who have metastatic disease or men whose disease has progressed after local treatment with surgery and radiation, but certain men who are elderly, in their 80s, frail, and not fit enough to tolerate chemotherapy, I would recommend hormonal therapy alone.
Okay, could be good for a lot of people. All right, Dr. Dave, thanks. And you can find more on her advice on our website right now. It's at yourcentralvalley.com. Stay with us.